This is Dr. Jonathan Lebowitz of Lebowitz Plastic Surgery, located in Huntington, Long Island, New York, the Long Island Gynecomastia Center, and the Long Island VaserLipo Center, where today we're adding to the YouTube video a young man, he's in his early 20s, who complains of gynecomastia. Gynecomastia is really just fullness of the chest. It could be gland, it could be fat, it could be a combination of both. Most people is a combination of gland and fat. Gland is gynecomastia, and some people call the fat pseudo-gynecomastia, but it really is gynecomastia. Just means that you're unhappy with the size or shape of the chest. Today we're using the Vaser technology, ultrasound technology, right here. That's the machine. He's already numb. I've numbed him up a little bit, and you got to do these little ports because this is ultrasound, and ultrasound could actually harm the skin if it comes in contact to the skin. So we, under local, he's awake. Say hi.
Hi.
He is totally numb. He will not feel a thing. And we're going to get extraordinary results. The Vaser is an ultrasound. I'm starting with the one ring. The one ring gives 75% of the energy at the tip and 25% of energy at the periphery. You can kind of see that one ring going on there. And eventually we're going to go to this 5 ring. You can kind of see that, which is the opposite. 25% at the tip, 75% around. And then we use some liposuction and to contour and sculpt and shape the chest so he is proud and sexy. Manly chest. So we're going to start. We've already numbed him up, as I said, and you're going to hear the sound. It's ultrasound, almost like a dentist cleaning a tooth type of a thing. And it's very easy. You go in there, nice and calm. He's awake, not under general anesthesia, so it saves money, and you don't have an anesthesiologist right there kind of in the way. He came with his parents, nice parents, and they're doing it for him, and he's going to be happy and thrilled and be able to take off his shirt, play basketball, and be proud. And we kind of are melting and whittling away at this gland. So we're going to make a hamburger, a big half-pounder, into a little slider. And then you're going to see, as per my older technique and my older videos, we're going to make an incision at the edge of the nipple, much smaller, much less conspicuous, and no drains. So what I do, unlike a lot of doctors, is that, since I don't have an anesthesiologist pushing me to do another case and this and that, and each people, they have great experience and great, in my office, I don't rush. So I always go into the upper abdomen. I want to contour. I want to shape. I want to contour. I want to get excellent results, no matter how much time it takes me or the effort. Results are most important to me. And we're going to go up to his pectoralis edge here, into his armpit here. Get down here, and it's important to contour the whole area. Really do a great job. See this? I'm bombarding this, and you can see the nipple kind of jumping at me because it's really getting right at that edge. So let's do the same thing on the other side, Cookie. You can bring that closer to you. Go for it. Okay, so I did the 1. Okay, that's the dissecting tool. So I'm going to do the 3. So now I'm using the 5 ring, and that's 25% around. See, but a lot of people don't go like way over here that I'm doing. You know what I mean? See this? That's where I can substantiate the extra time on. So when I do this, I don't just concentrate on this. I concentrate on this, of course, ground zero, and I like to sculpt all the way around. This is what makes me different than a lot of other people. Okay, so now we lipo. All this stuff. Look at that butter coming out. As I tell people, this is all the ring dings you ate. Okay, next, make a little incision right here. There you go. Nice. And it's perfect, look. Okay, we're almost done with this side. Couple stitches. No drain now. Before, we had to get all my instruments in there and say, Cookie, hold this. See?
Yeah.
So this is ground zero, right at the nipple. A little bigger on this side. Yeah, beautiful. Gorgeous result. Look down. And he's still swollen.
Wow.
Nice. This is Dr. Jonathan Lebowitz at Lebowitz Plastic Surgery, located in Huntington, Long Island, New York. 631-424-0101. That's 631-424-0101. The Long Island Gynecomastia Center, the Long Island VaserLipo Center. Just finishing a case of gynecomastia on this young man. Under local anesthesia, he's awake. He was awake the whole time. Big guy, who came in complaining of just gynecomastia, which was a combination of gland and fat. The fat we removed is about 1,500, 1,200 cc's, along with these two glands. We used this wonderful Vaser machine to ultrasound and bombard this gland, make it really into from a big half-pounder hamburger into a little slider. And we're able to poke this out in the teeniest little incision. No drains. Beautiful results. As you can see, he's still swollen. It's immediate post-op, and all the fluid that I put in here needs to come down, but look at his chest. And it is just wonderful, and he's going to have a fantastic chest that he'll be proud of. So if you have gynecomastia, you want to speak to me, absolutely. Give me a call, 631-424-0101, Dr. Lebowitz, and we will take care of you. Thanks for watching this video. Stay tuned for a lot more videos coming up. Please subscribe to my YouTube channel. Also look at me on Instagram, Dr. Lebowitz, for photos pre and post-op on Instagram. That's Dr. Lebowitz. And thank you for considering the Long Island Gynecomastia Center, the Long Island VaserLipo Center. Hope to see you soon.